Hi, I'm Mark Friedman, chairman of the Midsize Retirement and Healthcare Plan Management Conferences. I have Janet Turner Ezell with me today. Janet is manager of health and welfare for Apex Systems, and Janet has given a workshop for us at our San Francisco conference focusing on wellness. I want to talk to you a little bit about wellness and some of the things that you talked about during your workshop.
Okay.
One of the things about wellness programs today, and really for their entire history, is that it's very hard to come up with a fixed ROI. So you have a CFO that's looking for an ROI on a program they put in, and it's almost impossible to give them what the actual ROI is on a wellness program, especially in the age of benefit cuts, scrutiny of costs, and rising health care. People are afraid that wellness programs are going to see more attention and more cuts. What do you say to the CFO that says, this is just an expense, we get nothing out of it?
What I would say to the CFO is wellness is a long-term change that you make. It's a long-term venture. Much like when someone goes on a diet, they didn't gain the weight over the course of a year. It's something that they gained over the course of the time. The same thing with a diet. You lose the weight over a course of time. With wellness, it's the same concept. You start out and you'll see over the course of time there'll be an improvement in things such as diabetes, cholesterol, heart disease, because you're keeping it in front of your employees. You're saying to them that this is important to you, so you need to continue to work on this so that at the end of a period of time, you may not say, okay, this year I saved $1,000, last year I saved $5,000, but you'll see that your spend for those diseases have decreased because you've kept it in front of your employees, you've told them how important it is, and they continue to work on it. They continue to do walking challenges. They continue to have their numbers checked, know their numbers. They continue to have mammograms. You just keep things about wellness in front of them. Most of them are covered by the insurance plan, and you partner with the insurance plan as well. You partner with them in terms of your spend for wellness. Most of them have something built into your budget for your plan, as well as you have a small budget that your company has for wellness, and just doing things and keeping your employees informed. Over the course of time, there is a return on investment. Quantifying it may be difficult, but you'll see it in the long run with your medical spend coming down.
For as long as I could remember, there's been a distrust between employees and their insurer. A lot of that well-deserved. How do you convince employees that these wellness programs are really for their benefit, that they're a win-win? They could help keep insurance costs down, but they really help the employees' lives and help them lead better lives by being healthier, where they're looking at it and saying, this is just the insurance company trying to figure out ways to not give me insurance?
Trust of employees or distrust of employers and insurance companies is definitely a challenge. A lot of employees feel like when they do a health risk assessment that the insurance company is going to use that to find a way to not pay their claims, or the employer is going to use that as a way to terminate their employment. But we never see the results of a health risk assessment. That information never comes to us as the employer, and we're self-funded. We have no access to that data. We will get a report that says 10 employees, these are their names, they did their health risk assessment, because we have an incentive for our employees who do that. But we never see that information. Our insurance company does not use that information to find ways to not cover disease or a condition. And with the Affordable Care Act, pre-existing goes away. So there's no reason to fear what's going to happen with the information. And again, employers never see, well, this person has this condition or this person has that condition, because we only see who took the assessment. That assessment is for you to make a personal decision, you the employee, to say, I have this condition and I need to do this to get better, or my risk for this disease is X, Y, and Z, so I need to work towards that. It's never used to penalize the employee.
I think it's some great information. There's a lot of important points there. First of all, wellness programs, it's very difficult to say there's going to be an ROI by tomorrow. If the CFO is looking for that and doesn't want to hear about the long-term benefits, you've got a tough challenge on your hand.
That's true.
The other thing is that distrust that sits there between the employee and the insurance company, and sometimes with the employer themselves. You've got to really make sure that you take the effort and the steps to make sure that they understand that this is private information, this is because you care about the employees and you want them to be able to benefit from them, or you'll have no chance of success. You
That's
agree?
correct.
All right. I appreciate you being with me today. Thank you very much, Janet.
Thank you, Mark.